one of the things that we as women have been taught, unfortunately, is not to pay attention to our body, i.e. the pelvis. And so there are a lot of women who may have years of uncomfortable or discomfort during intercourse and not really say anything. So I think the conversation really should start out with, are you having any changes in sex? Because that could be multiple amount of things. So it could be position, it could be history of trauma, it could be from endometriosis. So I think as women, we should be very comfortable with starting that conversation. And also if you do start it with, whether it's a primary care or a nurse practitioner or your gynecologist, and you feel that it's not necessarily being paid attention to or being kind of dissected out to kind of find out what the issue is, then that's when you find another provider and kind of go through that. Because there are different things that you go to your gynecologist for, whether it's just a pap smear or whether it's for an ultrasound or a well-woman checkup. But when it comes to sex, I think that that's where people get a little anxiety about speaking about it. But if you pay attention to your body and be really body conscious and aware and start that conversation, I think that that's where the conversation should start. Fibroids, it kind of overlaps with a lot of other different conditions. So sometimes it's hard to pinpoint, oh, that type of pain is from a fibroid. There are people who know they have fibroids. Those are typically the people who will come in and say, I think it's my fibroid causing the pain because they have a history of having had a fibroid and they know it's of large size. So kind of dissecting that out can be not difficult. It's just it requires a conversation. But I think it really should start with being comfortable with our bodies and not being, scared to talk about sex at the doctor's office.